Good afternoon, everyone, and welcome to our webinar. We will give it one more minute and then we will go ahead and jump in and start. I'm actually getting pings from the team to go ahead and start, so we'll go ahead and jump in. Good afternoon, everyone, and welcome to today's webinar. Before we get started, I'd like to go over a few items so you know how to participate in today's event. You'll have the opportunity to submit text questions to today's presenters, myself and my colleague, by typing your questions into the question pane of the control panel. You may send in your questions at any time during the presentation. We will collect these and address them during the Q&A session at the end of today's presentation. And we will also be launching some polls throughout today's presentation. We'll actually start that first poll right now as we get ready to kick off the webinar. And that poll is tied to how is your health system addressing SDOH collection? So we are here today to talk to you about a fantastic new offering that GetWell is bringing to market, to talk to you about how you can get more value from your current relationships with us and walk you through one of our products, GetWell Navigate, and how it can aid you beyond just SDOH screening into navigation. And since I'm already talking, let me take a moment to introduce myself. Next slide, please. I am Dr. Chelsea King Arthur. I'm the Vice President of Ambulatory Products and Analytics here at GetWell. I also oversee our population health work alongside some wonderful colleagues. And we also have Maria, who will introduce herself.
Hello, I am Maria Reese. I'm the Senior Director of Health Equity and Community Services and have the privilege and honor of overseeing our Navigate team. So happy to be here with you today.
Wonderful. Thank you, Maria. Next slide, please. So I'm sure you're no stranger to this information, but 80% of our health is non-clinical. It's made up largely of socioeconomic factors like jobs, income, health behaviors, such as tobacco utilization, diet, and exercise. And the COVID-19 pandemic showed us that these factors have an outsized impact on clinical outcomes. As COVID-19 disparities emerged, the CDC implemented strategies to understand and address them. And during that time, they actually even launched the Chief Health Equity Officer Unit, which was established during the emergency response. And that establishment of that office within a governing body really demonstrated that we needed data-driven approaches and meaningful engagement with community institutions in order to start to improve outcomes for individuals while also looking at their socioeconomic factors. Moreover, this kind of started a more mainstream conversation around SDOH, making SDOH really no longer a fringe issue or a social justice topic. It's mainstream. Mainstream regulatory bodies and other influential organizations in the healthcare sphere are embracing what has been a central tenet of public health, which is helping people where they live, work, and play, which means that providing support to help overcome the barriers enacted by those very places. Next slide, please. And through the fiscal year 2023 inpatient prospective payment system, CMS started to require organizations for all patients who were 18 years of age or older and admitted to the hospital to be screened for SDOH. And beginning in January of 2024, it will become mandatory to do so. The Joint Commission has gone a step further, requiring screening and resource navigation for a portion of the population who's been screened, and NCQA has even created a standalone health equity accreditation, which includes a clear focus on SDOH. And there are also various states who are placing more emphasis on requirements around screening for social needs and providing resources to address those needs. Next slide, please. That said, with almost every major regulatory body, as well as every state, putting out some type of regulation tied to SDOH screening collection, we know that providers and organizations are limited by the resources in place to support the patient volumes of screening and navigation. In the current approach, to data capture, it can be manual and cumbersome, and supporting those patients at scale can actually burden the care teams and stymie scalability. Further, we understand that patients can be reluctant to disclose personal SDOH needs directly to their care teams, so care teams may not be getting a representative or accurate view of the needs of the patient. And then lastly, EHRs don't necessarily provide visibility into community-based organizations to direct patients with social needs. And further, other social care platforms don't provide adequate visibility to confirm completed referrals and highlight whether additional support for certain patients is actually necessary. Next slide, please. A recent study published in the Annals of Family Medicine showed that those asking for help when it's needed, it's really hard for them to do so and requires them to build a level of trust with their care teams. And to address this hesitancy, collection of social risk and needs must be done in a way that is comfortable to the patient and one in which they understand that their vulnerability is not a liability, but rather an opportunity to further engage with their care providers. The study ends up concluding with health systems really should determine ways to successfully assist patients when they desire help and offer resources to address these risks outside of the healthcare sector. And this means that health systems have to work to increase the comfort level of patients in reporting risks and explore how to successfully assist them when that help is desired. Again, offering resources that will assist them outside of the healthcare sector. Next slide, please. As I briefly have walked through and kind of shown in the earlier slides, health equity is complex. It is multifaceted and requires a comprehensive approach that leads with the patient and they're putting their needs first. And so because of that, I'd like to jump in really quick to the survey results of how you are currently collecting SDOH needs. So we have folks who are doing it mainly within their EHR or in other methodologies. Again, we know that organizations have various modes of collecting this information, and that even other could mean that you're using all of these, right? Some departments are doing their own thing, some folks are doing it manually, and some are doing it within the EHR. So it can vary greatly organization to organization. One of the things we're really excited about on the next slide we'll show you is that over the last 5 years, GetWell has made, oh, next slide, please. Awesome. There we go. So one of the things we'll talk about is that over the last 5 years, GetWell has made some very discrete investments to evolve our portfolio to best support SDOH and health equity. And it's to use the power of patient engagement solutions to drive better reach and access to care across all populations inside and outside of the hospital. Today, we're excited to walk through one of our flagship solutions in the health equity space and to demonstrate how you can gain immediate access to SDOH collection and leverage additional capabilities that we have to navigate patients to resources that they need. There's one more poll for you, which we'll launch right now, which is tied to that resource navigation. So how are you and your organization getting patients the resources that they need? Give it about 20 seconds to collect those answers. Sometimes I wish I had background music. It would feel and be appropriate, I think. All right, let's see those results. Community health workers and our care managers are taking care of it. That is fantastic to hear. We have some folks who are giving paper, folks who are doing other things as well. And really by taking a look at this information and based upon these various results and levels of navigation we see here, I think that my colleague Maria is about to share with you all something that will be very exciting to many of you. And so with that, I will hand it over to Maria.
Thank you. Thank you, Dr. King Arthur. That's great data to see. That will really help guide some of this presentation as well. So my section, we're really going to dive into the solution. What can GetWell offer for the SDOH screening and navigation solution? Next slide. So we are excited to share with you that as a GetWell inpatient client, you can now leverage a new configuration to unlock SDOH collection across your entire healthcare system. So using the Get Well interactive TVs or mobile devices using BYOD, patients and caregivers can now confidentially complete social needs surveys. You can also further enhance the SDOH collection through additional modes of data capture, such as text messaging, even using the Rounds Plus, and then seamlessly it all integrates back into the EHR, which is a huge win. So basically what we're saying today is we can turn on this complimentary screening feature for you now. Next slide. However, we also recognize that SDOH screening and collection is only half of the story. The other half of the story is helping providers navigate patients to the appropriate resources, as well as performing the necessary follow-up to ensure that barriers are removed for our patients. So we do this through high tech. We're using high touch approach to reach, engage, and navigate patients. So this is really where our Get Well Navigate product comes in. It automatically scans SDOH responses, develops personalized resources to meet the patient's needs. Through SMS text outreach backed by our live human navigators, we're ensuring patients know how to access the resources they need and direct patients to the right resources at the right time. I think that part's really important, the right resources at the right time. So our human navigators are successful because they represent the communities we serve. They're building trust, they're building engagement, all the things that Dr. King Arthur were mentioning in the study earlier. And we're making sure that patients receive their needs and that all vulnerable populations do not fall through the cracks. So why is this important to you? I look at it as kind of three ways that our Get Well navigators can help. One, we're a seamless extension to your tools and team in place. I just saw about 71% of you said that your care managers and community health workers are doing some of this. We can help bring that to scale. We can help enhance your team. We can help patients address their social needs. And three, we can reduce the burden on your care teams and really help enhance services. Next slide. So we wanted to share some of the data that we're seeing already through implementation of our solution. We're seeing that we are proving to cut across demographics and lead to higher than benchmark engagement. So one, we see really high bidirectional texting rates through our Black and Hispanic populations. We see higher rates with engagement. And then also when you look at our response rate for the SDOH survey, we are seeing about a 35% rate of patients completing that survey, which is higher than the national benchmark of 25%. I think a lot of that has to do with our navigators coming with empathy, with building trust. A lot of our navigators, over half of them are bilingual, speaking Spanish. So we are meeting patients where they're at and also just coming with deep empathy. Out of that 35% that complete the survey, we're seeing about 11% on average say yes, or screening positive for a social care need and saying, hey, I really need, some help, I need some resources. When you look at the breakdown of the resources, I'm sure it's no surprise to anyone, food and housing come up to the top consistently across the board. We know we're in a housing crisis in America right now. It's really hard to find safe and affordable housing. So we really work with some of our partners, whether it's Find Help, 211, whether it's the client that might have resources, to really identify some of those local, state, and national resources. Same with food. We see a lot higher food insecurity rates after COVID. So we're really making sure that we are identifying the right resources at the right time. Next slide. So what does it look like? What does this Get Well Navigate tool look like? How does it work? We wanted to show you a little sample. So by text, we can also do this through phone calls, but I'm going to demonstrate our texting option. So we have a survey that, the really nice thing about it, it aligns with CMS requirements and the SDOH screening needs that they are asking healthcare systems to perform. So it has questions around housing, utilities, food, personal safety, travel, social support. And so we ask this using plain language, making sure everything's health literate. If a patient responds yes to one or all of them, we have some patients that say, you know, I need resources for every category. What we're able to do is identify, again, those local, state, or national resources and automatically send them to the patient within minutes. So they're able to get those resources and do the follow-up. Next slide, because I think what is really important is the follow-up. So what we really take serious is, was this resource helpful for you? Because it's only going to be beneficial to the patient and to the client if we're able to navigate them to appropriate resources. So after they screen positive, we send the resource. In a couple days, we do a resource follow-up survey that just asks, was it helpful? They have 3 ways of answering that. Yes, it was helpful. No, it was not, or I did not ask for help for that. So if they answer no, and we've really built this out based on some literature review of what are the common reasons that resources aren't helpful. So the nice thing here is this helps not only us, but it helps the client as well. So for example, if we see a trend with a lot of patients saying, I haven't had time to contact the resource yet, we might spread out instead of sending it a day or 2 later, maybe we'll wait a little longer. Or if someone responds that the contact information was wrong, we can go back and update that resource. The way that this information is really helpful to all of you is that this can help inform maybe some of your strategic partnerships. If you have a community benefit or a community engagement department that's looking at where they should invest some of their community dollars, if we see that there's a trend that there's a wait list for housing, maybe that's an opportunity to partner with some local housing nonprofits and build some capacity. So this is all information that's available back to the client as well. And then if the patient says no, we're following back up to say, what wasn't helpful, what do you need? And we're finding new resources until we make sure that that was helpful for them. Next slide. And then one of our favorite things at Get Well is our patient love. This is a place that we share testimonials of our patients. We call it patient love. So we share these at meetings. We have a Rocket Chat channel, and it really grounds us and reminds us why we're, you know, in this work. It connects us to purpose. It shows the impact that we're making with our patients. And these are a couple stories from our navigators, Courtney and Judy. They both happen to do with food insecurity. So one is about a patient needing help with food because they're trying to also buy baby formula and pay for childcare. And so they needed help with food resources. We were able to send them. And the patient says she was extremely grateful for our call and was feeling a lot more optimistic. The story on the right side is about another patient whose food stamps got cut down to $23 a month, can barely afford to buy food, cover their rent, and has been through so much with their son and newborn. And here's the statement says, it's enough to be humbled and to know when to ask for help. Back to what Dr. King Arthur was mentioning about how hard it is to ask for help, but if you do it in a caring and compassionate way, you can get some of that feedback. And so this patient asked for help for all of our resources and was very grateful for our assistance. So these are just a couple of gems. We see these every day. They're very powerful, and we appreciate capturing this. So with that, I'm going to turn it back over to Dr. King Arthur.
Thank you, Maria, so much. As a reminder to everyone, if you have not done so, you have the ability to drop questions using the questions tab in the panel. So please do drop them in there. We have a couple in there so far, and I will go ahead and address them. One of them is, could you give a bit more information around navigators? Do they supplement care management? Are they outsourced care managers? Tell us more. So I will let Maria handle that one.
Yes, so we enhance care managers and community health workers. We've worked with them with different clients, and that is a conversation we would have as far as we can do some risk stratification. So maybe those really acute situations where a patient only needs a food resource. Maybe we do the more acute ones. We are a non-medical team, so I did want to mention that. But then maybe it's a community health worker or a care manager that takes the higher risk ones. We want to work to scale for your team. So if you want to utilize your care managers and social workers for those higher need patients, we can do some risk stratification and we can turn that on so that we can scale and reach as many patients as possible. Does that help answer it?
Yeah, I think that's perfect. Another one came in around configuration. Can surveys be customized? Are they templatized? What are the resources required? What are the resources required to turn on? So surveys can be customized. We understand that we are not lacking in SDOH surveying tools. So whether it be the Prepare survey or the AAFP survey, there are lots of tools out there that organizations are using to screen for SDOH. Programmatically, what we always will recommend as your partner is that you attempt to standardize the survey that's being utilized in your organization enterprise-wide. And then once you have made that selection of the survey you would like to use, we can use that survey and load it in to the tools for your patients to actually be surveyed. So right now, today, if you reach out to your customer success partner and say, hey, I just hopped off that webinar, we need greater reach on our SDOH screening. We need to make sure that we are touching every patient who's admitted who's over the age of 18. We have a survey, it's collected via paper. We can help you digitize that survey, put it into your instance of either TV, interactive television, or BYOD, and have your patients have the ability to access it that way. So you do have the ability to customize. We have a survey that's in place. It is an abbreviated version of the Prepare survey. It covers the regulatory need of asking the 5 domains plus the 6th domain that I add, which is I choose not to answer, because if you, as I'm sure you're aware of, if a person selects I choose not to answer, that checks the box of you administering the survey to patients. So we do have one. It's very basic. It covers food, housing, transportation, utilities, and personal safety, and then the ability to say I choose not to answer. So that is there. So if you don't have a survey, we have one we can deploy for you. If you do have one, we have the ability to customize it. So hopefully that covers that question. Let's see. There's another question that has come in around integrations. Can you walk us through how EHR integrations would work? So one of the things that we know is super important to our client partners, as well as the healthcare delivery system in general, is that it's really important to have this SDOH data, getting data driven in a way that's tied to social needs, and sharing that information back to the care team is super important. And one of the things that we are very proud of at GetWell is that we understand the power of your EHR and how much of your organization really does depend on the data that is there. And so we work in collaboration with our client partners to ensure that results such as SDOH screening results can be mapped back into the EHR. It is part of the implementation conversations that we would have with your customer success representatives and with our implementation teams to understand where that data would go and how it would flow back to your organization. But it is something that we as an organization recognize as being important and being essential to care delivery, and thus can work with you to figure out how and where you would like that data written back into your EHR so that it can be the most powerful tool for your care teams to use. Let's see, any other questions out there? I don't see any other questions that have been written into the question box. I'll give it another couple seconds to see if anyone has any questions.
And Chelsea, I can add something just as we're waiting if anyone has any questions. One thing I did not mention was around the client resources. So we do work with partners, like I mentioned, Find Help 211 to identify resources. But if the client has resources, internal or based on your community partnerships, we would ask for that also, and we would help drive patients to some of those resources. So I just wanted to mention that we work with the client on identifying those as well.
Perfect point. Thank you. So with that, I think I don't see any other questions coming in. So I just want to reiterate today, you can reach out to your customer success rep and tell them that you would like to turn on SDOH screening as part of your work with Get Well. We are happy to work through that process with you and to get it turned on so that you can screen your patients for their SDOH needs and meet the CMS and Joint Commission requirements that are out there. We are absolutely happy and thrilled to have additional conversations tied to navigation because it's imperative to do something with that data once you have it. And if you are already screening but need help working through how that navigation portion of it could work, also happy to sit and have those conversations with you. We appreciate your time, but moreover, we appreciate the work that you are doing to understand the needs of your patients and work diligently to address those needs day in and day out. We recognize that the climate is difficult and that not every day delivering care is one that is easy, but we absolutely appreciate the work you are doing. If you have any questions, do not hesitate to reach out to your reps here at Get Well. Do not hesitate to send us an email or give us a call. We are more than happy to answer any questions that you have. And with that, we are going to tell you, enjoy the rest of your afternoon. Have a fantastic weekend. And thank you so much for attending.
Thank you. Take care.